Welcome to Medical Coding by Jen, the podcast where we break down complex medical coding concepts into easy-to-understand insights for healthcare professionals. I'm your host, Jen, and today we're diving into the intricate world of combination codes in ICD-10-CM, with a special focus on diabetes medical coding. Whether you're a seasoned coder or just starting out, this episode will enhance your understanding and application of combination codes to ensure accurate and efficient medical documentation. Understanding combination codes in the realm of ICD-10-CM coding, combination codes play a pivotal role. But what exactly are they? A combination code is a single code that classifies two diagnoses or a diagnosis with an associated secondary process, which could be a manifestation or a complication. These codes streamline the coding process by encapsulating multiple related conditions into one comprehensive code. But how do we identify and apply these combination codes correctly? Combination codes are identified by referring to subterm entries in the alphabetic index, reading the inclusion and exclusion notes in the tabular list. When to use combination codes, it's crucial to assign only the combination code when it fully identifies the diagnostic conditions involved or when the alphabetic index directs you to do so. Here's a key point. Multiple coding should not be used when a combination code sufficiently identifies all elements documented in the diagnosis. However, if a combination code lacks necessary specificity in describing a manifestation or complication, an additional code should be used as a secondary code. This ensures that all aspects of the patient's condition are accurately captured. ICD-10-CM and combination codes. The C factor in ICD-10-CM, the use of combination codes is denoted by the letter C. These codes can reduce the number of codes needed to fully describe a patient's conditions. However, some combination codes require a secondary code to further detail a complication or the severity of the condition. Focus on diabetes. Let's take diabetes as a prime example to understand how combination codes function in ICD-10-CM. Diabetes is described using combination codes that include type of diabetes, body system affected, complication affecting the body system. There are 5 categories of ICD-10-CM codes for diabetes. E08 diabetes due to underlying condition, E09 drug or chemical induced diabetes, E10 type 1 diabetes, E11 type 2 diabetes, E13 other specified diabetes, secondary due to genetic defects, post-procedural. Each type provides a specific code for the complication or body system affected by the diabetes. Importantly, the ICD-10-CM coding guidelines in Chapter 4, Endocrine, Nutritional, and Metabolic Diseases, E000 through E89, state that if the type of diabetes is not provided in documentation, the default is E11, which stands for type 2 diabetes. Rethinking factoring components. It's essential to understand that certain concepts do not factor directly into ICD-10-CM code choices. For instance, controlled or uncontrolled diabetes, this is not a concept in ICD-10-CM coding. However, clinical documentation should reflect the patient's condition status and response to treatment. Insulin dependent against non-insulin dependent, this is also not a component in ICD-10-CM coding. Instead, you report the long-term current use of insulin for diabetic management across all categories of diabetes, except for type 1 diabetes, E10. Moreover, you may report more than one diabetes code for patients with multiple complications or when multiple body systems are affected by diabetes. This approach provides a more accurate view of the patient's condition, supports medical necessity, and highlights the complexity of medical decision-making. Case studies applying combination codes. Let's bring this to life with 2 case studies. Case number 1. A patient presents with type 1 diabetes with no complications. Her blood sugar levels are well controlled with Lantus, exercise, and diet. She will continue with the same medication dosage, monitor glucose levels, and return in 3 months for a recheck. ICD-10-CM coding. E10.9 Type 1 diabetes without complications explanation. In this case, the patient has type 1 diabetes with no complications and normal blood sugar levels. Since there are no complications and the use of insulin is inherent to type 1 diabetes, there's no need to report insulin use separately. The combination code E10.9 sufficiently captures the patient's condition. Case number 2. A 56-year-old obese male with a long history of adult-onset diabetes is seen for a follow-up evaluation. He has no new symptoms but has been dependent on insulin for 10 years and has stage 2 diabetic chronic kidney disease, CKD. He does not maintain his calorie intake or diet. Vitals: weight, 245 pounds, height, 5 feet 10 inches, blood glucose, 125 milligrams DL exam, otherwise unremarkable calculated BMI. 35.1 assessment, type 2 diabetes with CKD stage 2, obesity ICD-10-CM coding. E11.22 type 2 diabetes with diabetic chronic kidney disease. N18.2 chronic kidney disease stage 2, mild. E66.09 other obesity due to excess calories. Z68.35 body mass index BMI 35 to 35.9 adult. Z79 point for long-term current use of insulin. Explanation: here the documentation shows a type 2 diabetes with an associated chronic kidney disease, CKD stage 2. The combination code E11.22 captures the diabetes and its complication. However, because the patient also has obesity and is dependent on insulin, additional codes are necessary. E66.09 for obesity due to excess calories, Z68.35 to specify the patient's BMI, Z79.4 to indicate the long-term use of insulin. This comprehensive coding approach ensures all aspects of the patient's condition are accurately documented. Key takeaways: combination codes streamline the coding process by encapsulating multiple related conditions. Always verify whether a combination code fully identifies the diagnostic conditions before opting for multiple codes. Understand which clinical details do not impact ICD-10-CM coding, such as the control status of diabetes or insulin dependence, unless it's a separate component like insulin usage. Use additional codes when combination codes lack necessary specificity. Accurate documentation supports not only proper coding, but also medical necessity and complexity in patient care. Closing remarks: navigating ICD-10-CM combination codes can be challenging, but with a clear understanding of the guidelines and thoughtful application, you can ensure precise and comprehensive medical coding. Remember, accurate coding is essential for effective patient care, appropriate reimbursement, and the overall efficiency of the healthcare system. Thank you for joining us on this episode of Medical Coding by Jen. If you're enjoying the content and finding it helpful, please support me by liking, sharing, and commenting on the video. Your feedback helps me create more valuable content for all of you. Until next time, keep coding accurately and confidently.